Scott County, providing safe, healthy, and livable communities.
On to item 5 on our agenda. Scott County delivers, and Chris Harder will kick us off.
Good morning, Madam Chair.
Good morning.
We're here this morning with a large group of folks to talk about early child development and early literacy. And many of these same folks were here last year. So we're going to focus some attention today on changes over the last year. Also, we are aware of a significant workload for all of you this morning and some time constraints. So we're going to change the formatting just a little bit to try to get to our best questions more quickly. I'm going to ask the people on the panel to introduce themselves. Then I'm going to ask the presenters to introduce just who you are and where you work. And then we're going to move into questions about your role and some of those things later. Jake, you've agreed to do some introductory statements. So after introductions, we'll go to you. All right? You want to start, Danielle?
Good morning, everybody. I'm Danielle Fox. I'm the Adult Social Services Manager here at Scott County.
Troy Pent with the Enterprise Business Technology.
Danny Lenz, Deputy County Administrator.
Jennifer Schultz, the Office of Management and Budget. My role on this panel is the co-facilitator of the Collective Impact Educational Prep Group.
My name is Cami Thompson. I'm the director of the New Horizon Academy located in Shakopee, and I am the chair of the group with Jennifer.
Jake Grusing, County Library Director.
Lisa Brodsky, Public Health Director.
Kathy Bush. I work with the CAP agency Head Start program, and I'm currently in the role of a Family Service Coordinator for the Shakopee area.
I'm Mary Kay Stevens, Public Health Supervisor in the Family Health and Family Home Visiting programs.
And I'm Terry Furman. I work with Public Health and I coordinate the Follow Along program.
I'm Lisa Pollard. I am the Learning and Outreach Manager for the library.
I'm Kim Litcherner, and I'm the Early Childhood Family Education Coordinator for the Shakopee Schools.
So thank you very much for coming, especially folks who have come from outside agencies. We're just really happy to have you today. Jake?
Hi, thank you. So we're here this morning to talk about early literacy. I think a few logical questions that might pop into people's heads is, like, first, why are we even talking about that? Isn't that a school thing? I didn't know that was a traditional responsibility of county government. But we are talking about it, and we're talking about it for a few reasons. The first is that it's important to our residents. So up on the screen on page 1 here, we have our result maps and this livable result, excellent schools and educational opportunities. Among all the things we do, the results we're trying to achieve as a community in livable, that's the most important one to our communities based on the resident survey that goes out every 3 years. That's the one they care about the most. And the work this group of people are doing and our programs impacts that result. Second, we have county programs that families and their children can choose to participate in, like the Follow Along program, the Read Mobile visits, early literacy classes. We have those sort of optional programs that we provide that help parents and families raise healthy and successful children. We also have programs that you don't get to choose to participate in. Some families have to participate in because of the situation they're in or some of the decisions they've made. So like child protection, we engage with families and kids sometimes long before the school districts ever have any contact with those kids and those families. And all of that, to me, and I think to the folks on this panel, represents different opportunities to help move in that direction of making sure we do have excellent schools and educational opportunities, and that our third graders are reading at grade level by third grade. That's a lag indicator of the first 8 or 9 years of educational preparedness. And we're still at about 1/3 of our third graders not being proficient readers, and we've been hovering there for 5 or 6 years in a row. So that's the result that we're still trying to figure out how to impact and see an increase in those numbers. And that's what the folks here at the table today are going to talk to you about. What are we all doing to move that work forward?
Thanks, Jake. Okay, could we start out? I think everybody who's going to speak is at the table. Is that right? I think. Okay. What I'd like is to have 3 or 4 of you talk about, like, what are like 3 strengths or things that are stronger or better today in the programming that you're providing and the outcomes for kids in our communities when we compare to last year. Like, where's the growth? And then panelists, I'm going to invite you to jump in on your questions.
Okay, I'll go ahead and start.
Okay.
I'm Kathy Bush, and I work with Head Start. The Head Start program, as you may know, is a federal program, primarily federally funded. That's an anti-poverty program, but certainly of high importance is school readiness for that program and strong literacy programs. So some of the things that I have observed and learned from others in our program that have changed or are improving are we do assessments of our children. And the program I work with serves children ages 3 to 5. We do an assessment 3 times a year with a tool called Teaching Strategies Gold. It's a vetted tool used nationally. Our scores have increased quite a bit over the last couple of years, particularly in the area of literacy. So we're pleased about that. Not that we don't want to continue to improve, but we are seeing improvements. We also work very closely with parents in our program. We're working not only to educate children, but to educate their parents as well. Many of our parents come in with not having a lot of education themselves or hoping to have more education, so we do encourage parents and help to support them to get a GED or high school diploma or higher education. We have more parents participating in those kind of programs in the last year. And we're pleased with that. We also have expanded a program called Early Head Start, so now we are working with parents actually from pregnancy up to age 3. So we have taken some of the funds that were allocated previously for ages 3 to 5 and converted those to Early Head Start because we feel it's more effective to work with the parents of these children at a younger age. These are all parents living in poverty. We've had a couple of challenges.
Could I interrupt you for just a second? Can we stick to like the pieces that are going well just for a second? And panelists, are there pieces about, that's okay. Are there pieces of that you'd like to ask about?
Yeah, and can you just speak a little bit towards how you're targeting those highest need populations, whether it's children who have experienced trauma, racial disparities, children with disabilities, and how is that impacting?
That's a good question. I do the enrollment for Scott County. There's a formal application process, and we are very fortunate to get referrals from a lot of other partners in the community. That's prescribed for us from the Federal Head Start program. We first will enroll children who are in a homeless situation. Homeless does not necessarily mean that they're on the street. They may be doubled up with another family member or going through a transition, but we target homeless. After that, we look at children who have an identified special need. We then go to foster families as the next group, and then it's by income. So if they're below the federal poverty rate for their family size, they enroll next, and so on until we reach that federal poverty rate. We very rarely enroll for somebody who's older or above that poverty rate. We will enroll 4-year-olds first and then 3-year-olds. A person who gets in as a 3-year-old will automatically be enrolled the second year if they wish to be. We always ask, do you have transportation? Because we are no longer funded with transportation. And I can address that later if that's a barrier.
Thanks.
And I should also say we consider very strongly any referral that we get from a county worker or a school, somebody with the school system.
Thank you. Go ahead, Kim.
You asked what was going well, and I think we realize that we cannot make change in kids' outcomes unless we all partner and work together. And that is the thing I think has most changed in the past 2 to 3 years, is that we realize that it's not about just what kids learn, it's about the homes they're in, it's about the families they're in, and getting all that kind of support. So partnerships are huge. And so when we think about all the things we're doing, like the assessments and alignment to schools, using the same language, literacy curriculums aligned with the schools, it really is so much deeper than that. The kids have to know how to do school and have to have that internal, I can do this. Because as kindergarten teachers say, I can teach a kid anything if they're ready to learn. But if they aren't internally ready to learn where they're at. So one of the things I'm grateful is we've partnered with public health in providing the Ready for K classes for parents with 5 different age groups, babies, 1s, 2s, 3s. We've aligned with Head Start, and we're using TS Gold for assessments and things like that. Last year, we received a mental health grant, the public schools did, and we learned a lot from that. We now have a Connect therapist at the Central Family Center, and her caseload's full. So it's really getting into these kids' homes and with their parents, and also, hitting those high target groups that are below the poverty level. And so serving them in Head Start, serving them with scholarships in the child care industry, and serving them with scholarships at the preschool level within districts like the Shakopee Schools does. So thank you.
Thank you for your comments.
I think I'd be remiss not to mention some of the other collaborations. I completely concur with what you're saying, but as you know, the Birth to 5 group has been meeting to talk about, which is county staff and an increasingly broadened community participation, talking about how we can do better in early childhood for families where substance use is a challenge, to do some decreasing of out-of-home placements. And there's just been wonderful conversations and relationship building, and we're really working hard on what our measures will continue to be moving forward. There have been collaborations with the WIC, with all these partners at the table, the Educational Preparedness Group. There's just a lot of discussion and effort going on towards how we build the foundations for kids so that they come ready to learn. Those literacy and language skills start very early, even with a healthy birth outcome. And so how do we continue to support families, particularly those who have some obstacles to being able to provide an optimal environment for their kids?
Nice. Thank you. Lisa, you were going to kind of man the data piece of this. Are there pieces of the data that stand out for you as areas that you think are significant areas of growth?
Yeah, I think we're a little bit smarter than we were last year, so I think that I would consider that a success. We've really been focusing on trying to figure out what's going to make the biggest difference. So who's most at risk. Public health really likes to look at those, who are the highest risk kids. So we've been doing some data analysis in Scott County, looking at, we know from best practices that kids should be screened at 3, and we're hearing about kindergarten surprises showing up on the first day of school and they haven't been screened. So we really did a deep dive data analysis on that, and we found that kindergarten surprises really aren't the issue here in our county. In other counties it happens, but it's not here. What we did also note, though, that there is, screening at 3 is making a big impact. We found when we did some data correlation that as the percentage of children in Scott County, when they were screened at 3, as they increased, 3rd grade reading levels increased also. And if they were screened at 5, the more kids that were screened at 5 instead of 3, the 3rd grade reading decreased. So that is an issue for our county. Kids are getting screened, but they're not getting screened on time, or they're just getting screened too late. So we really want to get them in at 3, and that really seems to be having an impact. The other piece that we did a deep dive analysis on are those risk factors that we have talked about. Hispanic kids are 179% times higher risk.
Can you give us a page number?
That would be on page 7 and 8. So we really looked at who's most at risk. We cast this really wide net when we're sending out materials, et cetera, but if we really want to look at who is most at risk to be not meeting those reading standards, we looked at race, poverty. They're 186 times at higher risk of not meeting it. Kids who speak a different language at home are 201% times the risk of not being proficient at 3rd grade. Children in child protection are also 152% times not meeting those standards. So if we really want to focus on where some of those significant gaps are, that's really kind of where we should be targeting our effort. Some other progress we've made since we last met is we've met with the Shakopee School District, and we're currently developing a data sharing agreement with them as a pilot to really take a look at the cohort of 3rd grade readers and do some analysis from 3rd grade backwards to when were they screened, well, starting with who's meeting and who's not, when were they screened, what programs did they participate in, from birth outcomes, what were the risk factors at birth, to really trying to figure out what is making the biggest difference in these kids, and we'll be moving forward with that shortly.
Nice.
So you talked about doing a look back at sort of what happened prior to. Do you have data that indicates what happens afterwards? And can you tie these pieces together? I heard you say the screening and the third grade reading levels you've certainly been able to tie together. Are you able to tie third grade reading to high school graduation rates? And then beyond that, things that those children are then experiencing as adults, whether it's homelessness or experience with corrections or quality of life. How do you connect those pieces together?
I think the school district is already doing that on their end, but we haven't. I mean, we could certainly do some of that analysis. We haven't talked about doing that yet, but we know from best practices and from evidence-based research that kids who are reading at third grade are more likely to have gainful employment and graduation and go on to college. So we could take a look at that as it pertains to Scott County kids.
So what are some of the interventions or opportunities available for some of these target groups? So like speaking a different language at home, like what are our approaches to getting out and having contact, and what's our engagement strategy there?
Do you want to talk about the book bag?
Yeah, absolutely. I was like, this would be a good time to jump in. So our Readmobile is an excellent opportunity to go out into the community. We do a lot of great things in the library for early literacy with our Every Child Ready to Read curriculum. But unfortunately, that's of course limited then to people who can make it to the library. So the Readmobile has given us a lot of opportunities to go out into the community, and you can see if you look at the report on, I think it's the last page, but that we have, we saw over 1,700 kids last summer. That's a 45% increase over the kids we saw the summer before. So we're able to get to more kids, and more kids have the trust and willingness to come on board. And many of the communities that we visit, a couple in particular, have those high percentage of kids who come from Spanish-speaking families. So our Spanish language outreach person, that's just an instant connection because she's from the community, she speaks Spanish. They're very comfortable with her, and so that's a really great opportunity for kids to connect with somebody who talks like them, looks like them. Parents connect with her really easily, and yeah, that's some of the great things that we're doing to get out into the community and reach some of those folks that aren't coming to us in the libraries.
A strong component, I think, in the schools is the PACE Family Literacy Program, and it was a federal grant 20 plus years ago, and we're proud that it's still going because it's an extremely expensive service for families. But we have 45 non-English speakers, which are adults and usually mothers, so a total of over 100 in the afternoon program Monday through Thursday. I think the benefits of that is that the parents are increasing their English skills with adult basic ed and ELL. They're getting some parenting and talking about child development, and then their kids are also partaking in some real quality preschool education to ready them for kindergarten. So,
another initiative that we've done through the educational prep group is the texting campaign that started in the summer of this year. Since we started in the ed prep group 3.5 years ago, we've talked about a literacy campaign, getting the word out about how important talking and playing and singing to children are at that young age. So this summer, I think we went live in June, partnered with Think Small. They already had a texting campaign. So we were able to jump on board at no cost with their texting campaign. And actually then we were also able to customize some messages that parents can get via their phone specific to Scott County. So we have, it's all based on age. So you register based on the age of your child, and then you get messages about your child's development, about activities you can be doing with your child. specific to Scott County, we've had messages out about what's happening at our libraries. Public Health has provided messages, and so they just come via the phone, and those messages, you can sign up in English, Spanish, or Somali. So right now, I think when I just talked to Sarah, we have nearly 100 families signed up for the texting program. So that's an easy piece that when folks are working with kids and families, they can really just give them the number, they go on their phone, and it's just a message that they get that gives them some great tips for their child depending on their age.
Yeah, it's really a nice customized program, and we give those out in our early literacy classes. Blanca, hands out the Spanish version of the bookmark and talks to families about what this entails and how to get signed up.
Yeah, we have marketing information too, so if folks are interested in that, they just need to let us know, we can get that out.
And as I've enrolled parents in the Head Start program or had parent meetings or been on my one-on-one visits in the family home, they've been very excited about the texting program, and those who have been receiving the text feel it's very worthwhile. And it's really pretty easy for us to get people.
Yeah, it's a really easy way to get information out, and again, all parents can use, basic information about development and what's out there and what's available and vaccinations and all of those different important pieces.
Can I ask, are there, like looking at pages 7 and 8 where you have laid out some of the populations of kids that are struggling, is there research, are there best practices about how to reach families in those communities to support screening and literacy? Are there targets, like through your collaboration in the community, are there targets, or like, I guess I'm trying to figure out like how focused is that work?
I was going to say, I'm not sure about best practices related to that, but I think several of our programs are already touching these families. And so a lot of it is, since we're already working with them, so for example, the Child and Teen Checkup program sends letters out to all kids, families who have children on MA about going and getting their regular visits and the periodicity, and they send them regular letters to remind them, and they call them. So what we've done there is incorporate, when we send out letters, and we send out thousands of letters, we've incorporated the early childhood screening letter as well. So it's really, we're already touching them, we have this opportunity, and how can we maximize that opportunity as well? We've also been working with the pediatricians to ensure that, or to try and get them all on board related to the Reach Out and Read program. So they're also talking about literacy while the family's already there. And then the home visitors, you want to talk about
Yeah. Home visiting in and of itself is an evidence-based with research findings to support school readiness and increasing parental abilities and other outcomes. And we're already geared towards finding families who are in the greatest need. So by virtue of that, we have that opportunity to connect with families that need more support, regardless of their barriers or what their challenges are. We have those opportunities to work with them to improve things. And I don't know if this fits here exactly, but one of our newer initiatives is that we have a Welcome Baby Bag. We have small funding from one of the health plans. And so what we've got in this bag are some educational materials that we can take to families to support parents early on. We've got some important resources in the community. We've got ReadMobile information. We've got the texting campaign information. We've got cards from the school district so they can get connected to ECFE and get on the district radar so that we don't have kids falling through the cracks. We've got some key safety and parenting pieces that we cover in our home visiting programs. And so we see this as an opportunity to get things out to families who just need a little bit more support to know what's in our communities to get connected.
And then a future plan will be when the county will be taking over WIC in 2021, and those are, we know that those are also high-risk kids due to the fact that there are also kids living in poverty, and we're going to try and incorporate some seamless transition between WIC and school district information and some data sharing with between WIC and the school and really getting them connected, and as well as ensuring kids, as soon as they turn 3, because they're in the WIC program until 3, as soon as they turn 3, have you had your early childhood screen, either walking them over across the street to Central Family or possibly doing the screening ourselves here, just to make sure that they get connected to those resources.
And then sometimes we just try stuff. But maybe often it doesn't work that well. So with, just not for everybody, specific to the Readmobile, we might hear, for instance, that there are a bunch of kids, or it looks like there are a bunch of families in this particular neighborhood at a manufactured home park. So Lisa, Allie, Blanca will say, all right, let's try and make a connection there and show up. And sometimes we show up and the kids don't show up. And then we show up again, and maybe one kid kind of looks at the Readmobile from afar, but still doesn't come on, and then we show up again, and then more kids will come on the Readmobile. And sometimes that goes really well, and then we learn about other needs that those kids and their families might have. But we fail, and I think we're open about that. And I think our whole county is pretty open about that we try things, and sometimes they go really, really well, and we learn from that. And other times we try things that don't go well at all, and we do better next time.
And we're always trying to adjust to the situations that we're discovering. Like, surprise, found out one community that we were visiting in the Prior Lake area, we were seeing all Russian families. And so then it was like a scramble to find someone who could act as a Russian liaison and speak the language and join us on our Readmobile visits, and it's been one of our most successful visits, and especially in terms of attracting preschool families. So that's been really exciting. And also just trying to read, like Jake said, what are some of the needs. And it's not quite as random, I think, as Jake makes it sound. We do look at school data and try to focus on communities that have, high English language learners, high free and reduced lunch. But yeah, so we may come on and discover that, if we're meeting kids after school as they're coming off the bus, they're really hungry. And so to have some kind of quality, healthy snack is going to be really important before they can even get to that point where we can start to talk to them about, what are you reading? How did school go today? And then just like letting that happen. And if they had an active shooter drill in the school that day, what we may need to do is let kids act those out. And as much as it breaks our heart to do that, that's what that child needs at that time. So being flexible to meet those situations and what those kids need.
So when you talked about the WIC being able to easily transition to understanding if the students that are going to the Shakopee School District are meeting assessments or getting the assessments or getting services, is that part of the plan with that data sharing to be able to see where our interventions have helped or what impact they've had with those students as they move through? One of the things in one of the prep conversations was we try a lot of things and we're not quite sure what sticks and what really impacts it. So is getting to that data one of our bigger goals with this data sharing project?
Sort of. Yes and no. Really, the goal is to get the kids connected to the school. We know through some data sharing that we did that the Shakopee School District, for example, is missing about they have about 75% of the births, so they're missing about 25%. One of the pieces of that is that they get funding based on the numbers that they have, so they're losing money, so we really want to ensure that they have the whole list. So how do we ensure that between birth and time they're ready for K, that these kids get connected and they get on the student census? So WIC starts at birth, and actually in some cases there's prenatal moms, so it starts early, and being able to share those addresses with consent, of course, with the school district, so the school district can get connected with them, will improve the school district's outreach efforts, and then hopefully the hope is that by the time they are ready for K, we'll have connected with them and we'll know that they participated in WIC and possibly ECFE, et cetera, et cetera. So we'll have that data that we can share amongst ourselves and figure out, by the time they get to K, did these programs make a difference? Now, we're not going to probably be able to say that this particular program made a difference, because there is definitely a cumulative effect, thank you, of these programs, but at least it's those connections, it's those building, those bridges for these families. So that is the hope and the goal, and hopefully increase, we probably could figure out a baseline of kids in WIC that were not screened at 3, and to see if we maybe hopefully increase that. But that is the aim and goal.
You probably won't give yourself a pat on the back for it. So kudos to you and to Superintendent Redmond. We have Kim here from Shakopee Public Schools, but the willingness to just jump in and see that bigger picture, that the school has data that is important and helpful to us, and we have data that might be helpful and important to the schools, and being willing to just push that vision forward is just worth recognizing you for. I think the piece that's important to call, the theme that's coming up for me is like the folks from me down we have like these little slivers of impact. We have our little programs, and it might be a touch for half an hour, it might be a couple minutes on the Readmobile, it might be part of a day, a couple days a week, and we want to know what is the impact of that. We're doing that over and over, but it makes me think of what the last time Paul Nelson was here, right before he retired. Somebody told a story about how a person had asked Paul, how are we going to preserve these open spaces in our county? And Paul's response was, we aren't going to do that. It's the residents, it's them, it's the fam. So in our case, it's the families. We aren't going to be the ones, and it's to Kim's point earlier, we're not going to be the ones who can solve this. It's the families and their kids working together. But the person sitting on my right, Cammie, at New Horizon Academy, you get to spend 40, 50, 60 hours a week with some of these kids and families, so your impact is just different, different scale than some of the folks on this end of the table.
Yeah, definitely, and we also have children oftentimes from 6 weeks old or a couple months old to sometimes 7, 8, 9 years old, so we'll have families for several years at a time as well too. So that definitely can make a big impact on a family as well. So yeah, thank you for that. It is a little bit of a different way that we work with the children than some of the county services, but can make a big impact on their readiness for kindergarten and the amount of time that we're able to focus on literacy development with children and start that process even as little as in our infant rooms, with just exposure to a lot of talking and singing and reading to them and hearing vocabulary, and our biggest focus with that is just trying to create, kind of like you said, a love for learning, a love for curiosity. It's not necessarily about them leaving our places, being able to read or write, although that often is what happens. It's more about them being loving learning and being curious and asking questions and having the ability to do that, and supporting families in that whole entire process. And we do often get families who also are in crisis, or children who've experienced trauma, or children who are in foster care. So we're also able to impact those families as well too, in a little bit of a different way. So yeah. Thanks.
I'm wondering if you could speak a little bit about how you're gathering data to inform your practices. It sounds like you have many mechanisms that are formal and informal. What are you collecting directly from individuals with lived experience, whether it's children themselves or parents, and how does that inform your work?
I can start with some of that. One of the things we find out from parents in our early literacy classes is we do an end of fall survey with all of them, and we ask them about, we ask them what their favorite early literacy practice is, which sounds like a fluff question, but what we really want to know is, do they know what that means? So we get good results on that, and we get good results on, are you using things from class outside of class? Because we only see those families, once a week if we're lucky. our focus is really giving them the tools to use these practices and things at home. So that's one of the things that we look at. On the Read Mobile, one of the things we look at is do we have repeat kids? Again, it's, if we visit, if they come on once the whole summer, I doubt, we could say we've had an impact. But if we have kids coming on over and over, we have a chance to have an impact with them. And then also asking them the question, did you read more this summer because of the Read Mobile? Yeah, an overwhelming yes. So that's some of the data that we collect. It's not, it's not a super scientific study, but we are asking those questions, and we want to make sure what we're doing, we're accomplishing what we want.
Some of what we do, I think, is so subjective to the client. And so in early childhood, I think wherever you are is there's formative and informative assessments. But in our programs, whether it be the Family Lit program or parent education or those kinds of things, it's having the parent rate them before and after as far as their relationship with their children. Do they know the developmental expectations? Where have you grown? Where has your child grown? Things like that. But then we do have some, like the TS Gold, but still in early childhood, it's authentic assessment over time. We don't have the MCAs. It's something that's just this is how a kiddo or a family is doing. So some of that does impact some of the data we see.
And I think that kind of goes to the importance of quality programming, because all of us do assessments, and assessments are actually a really informative tool and a good partnership between parents and the school to have just time to sit down and talk about development and come up with goals. And all of us are using the exact same assessment tool. So I think that assessments are a really great way to be able to have that one-on-one time with parents and take a look at where things are at developmentally and what goals we want to work on moving forward. So
In the Follow Along program, which is very much earlier, birth through 3, before they even get to early childhood screening, I use the data, and we look at the data at that to even look at where are the bigger places where we're seeing developmental delays and concerns. And so we try to adapt what we're sending parents in the Follow Along program to provide additional information, or we're looking at participation in the program. And so we'll try a strategy. We added post-age, and we increased the response rate by 10% by doing that. So we use the data that we have to find ways to improve and meet parents' needs and identify where some other concerns might be that we can hopefully build and address.
Nice examples.
Most of us do a community needs assessment, kind of an evaluation. Those are requirements from the state. And comparing school district community needs assessment with public health needs assessment, you get this big picture, and it shows who you're reaching, who you're missing, the barriers, and all those kinds of things.
I think we're going to have, I'm sorry.
I was just going to say, in the Head Start program, we do a family partnership plan. So there's a large assessment with the parents near the beginning of a program year, which we work with. It's a tool we work through the year and then revisit at the end. But to determine what other partners, what services has the family been involved with, what are their goals, what can we do to support that? Sure. And it's an ongoing tool, but it's really directed at the parents, because we believe very strongly that parents are the most important teachers for the children.
I think we're going to stop at this point and just ask if there are questions from the audience, and also want to have the chance for the commissioners to ask any questions.
I have a question from the audience.
Question from the audience.
So this is obviously on the board strategies for next year as well. We heard Beacon talk about the importance of stability and the foundation from housing and kids and moving forward. Our next workshop even is after this is on kids and the importance of it. So if we were sitting here next year, which I think you will be, what would you like to see different, or what would you want to have accomplished by next year?
Mine is something that I don't even know how to begin to accomplish it, but I'm also we all use the scholarship program, but I think one of the things that can make the biggest impact for children that we're looking at serving is figuring out some sort of way to make quality childcare programming affordable for children. So scholarships is a huge way to support families, but scholarships only goes so far. CCAP can only reach a certain amount of children and families, and there's also a whole barrier families. I just had a discussion that just are like right above that income qualification. So, and then they kind of have no support, so they're the really struggling families. And I think if children can get in quality programming, it's a big way to impact their readiness for school and outcomes for predicting them to be ready for school and having a foundation of, social skills, a love for learning, early literacy, and I think that affordability for childcare is an issue, so.
If you're talking about affordable housing, we're ready to go out there. And so if you think about affordable housing, community spaces is huge because transportation is a barrier. And I think we are all willing to go where the need is. So if there was a space, within a facility, a community room or those kinds of things.
Agreed.
I think we could really reach more families.
Because we can't always even fit the Remobile into all the places that we would like to go.
I don't know if that has anything to do with what you're talking about, but community spaces within living units.
And I'd say in terms of, I'm sorry.
Go ahead.
Remobile, I would like to see us being able to reach more English language learners in languages other than Spanish and Russian, like we're doing a good job with those languages, but we haven't hit Somali yet, we haven't hit Vietnamese, and those are high also in our community.
That would be an additional add-on on my wish list is I think there are more families out there who could benefit from knowing about supports that are there. To some degree, we're restricted by the resources we have, and families have a varied gamut of needs. Some don't need long-term intensive, some just need some good connections and things to know about what's out there. It would be lovely to have be able to have a universal approach to that, so that we are connecting with families much earlier before we're finding out that they're lagging at early childhood screening or at third grade level, or that they're coming into child protection and could have had an opportunity with some additional supports around their challenges. So.
I think those silos are looking increasingly wobbly to me. If I look out at sort of the horizon of our work, we talked about kids before this conversation about kids. You're going to talk about kids after this conversation about kids, and I think more and more of that is happening. When we talk about housing, we're also talking about kids. When we talk about kids, we also end up talking about housing and jobs and transportation. I would hope a year from now, we talked about kids yesterday, and we're talking about kids today, and we're going to be talking about kids tomorrow and the day after that as well.
Is that another logical partnership? Like you're kind of embedded in a proposed board strategy around that includes child protection. Are they another logical partner to your group? Or maybe they participate in your group, I'm not sure. I just have a little bit of history in child protection. So with them being a high-risk population, like where do they have a place on your team, I guess?
Okay. I think so. I don't want to speak for the whole group, but I think we would invite, we'd probably say everybody everybody serves youth, everybody has a place at this table. And we've said there's no silver bullet and there's no, I don't even think silver bucket. I think we need like the whole hunting party. We need folks each pursuing their own game out there. Some of it is housing, some of it's transportation, some of it's jobs, some of it's particular programs, as many as we can get. It'll be a better day for us.
Madam Chair.
Thank you. Questions from the board?
just had to laugh about Jake's hunting reference. You would think he lived here in Scott County instead of. I have a couple comments, and maybe you guys will think of some things, but I was really heartened by Kim's statement about, in the last couple of years, all the connections that have been made. And what we hear from that is not, I know everybody would like more resources, but this wasn't more resources. This was connecting the things that are already in place, breaking down silos that probably should have been happening decades and decades ago, you know. So really heartened to hear that. My hope would be that we can continue to do that throughout the county. That's been quite Shakopee-centric because we got to start somewhere, and it's worked well. But I hope next year and in 2 years we're hearing about how that's happened all around the county, how we've connected these resources that are already here to better serve families and kids without, I mean, this isn't something, I guess if we find a bucket of money, we might put it in here, but we don't have all these buckets of money. Let's make sure we're doing that. And so that was a great piece. The other thing that I heard, and I serve on the committee, so I should have been thinking of this, is when we see those statistics about kids and child protection, and it's like, wow, as a county, we have some real ownership and ability to impact that. We need to get those folks on the team, and we can probably be making some real strides there. So those were just a couple of the comments that I heard, and some real promising things. That I like the way it started out with, what are the successes? What have we seen in this space where it's been kind of fuzzy, you know, and like Jake started out, why do we care as a county anyways about this? Well, we care because we care about our citizens, but long-term it impacts many of our programs, many of our expenditures. So I loved hearing those things. Any other? Yes,
Sure,
Commissioner
yeah,
Beard.
I would dovetail on that whole idea that it's people coming together. And I heard Jake say that, and Paul's living on already. His legacy's already started one meeting later. That it's not the government that's going to do it, it's the families. The families are going to provide the solution. I heard Cap say that parents are the best teachers. And that to me is, when the people are involved, that makes it sustainable. It's not some government program that we're going to go and fix this thing and we got a pile of money and a bunch of people. Plus, Jake's already learned how to answer these questions. We got to change this. That, well, we're talking about kids today. Now we're talking about kids tomorrow. We're talking about kids, but it's a moving target. But the more that the families are part of the solution, I mean, government can't do that, nor should they, in my opinion. But maybe that's a little too much editorial. So I was heartened to hear those two comments, and I'm hoping and I think that it is pervasive throughout at least that side of the table, and hopefully the rest of what we do as a county. That's my comment. Thank you.
Other comments or questions?
Yeah, well, even our 5 minutes was about kids. Would hope maybe even that mentoring would have some place at the table over the next year as well, so.
All right, thank you all. Thanks for continuing to work on this, and thanks for sharing this good news with us. All right.